I know we got
Congressman?
Yes.
You're here in the Somersworth Senior Center, and it's great that you're sharing your views with seniors, and I'm a senior, although I'm still working. I'm just wondering if you can kind of describe a rationale for voting to raise the Medicare premiums 15% by the year 2017 and cut $8 billion from the Preventive Health Care Fund. How does that help seniors?
I would disagree with that assessment. I think I'm not sure that it might be your opinion that I did that, but I would disagree that I actually did that. So what we're trying to do relative to Medicare is preserve and protect the program. And the first thing that we have done is ensure, with the bill that was voted on in the House, wasn't taken up by the Senate, is ensure that anyone 55 and older has no change whatsoever. And I think it's important for people who are 55 and older to know that, because there are different organizations that tell you that would tell you otherwise. That's just simply not the case. The legislation does not make any changes for anyone 55 and older. The legislation also considers what the trustees of the trust state, which is that if nothing is done, that Medicare goes bankrupt. And nobody wants to see that happen. I don't think any member of Congress wants to see it happen. I don't think any American wants to see it happen, regardless of their age. So one of the things that I've done when I come back and I talk to people, I say, here are 3 specific facts. According to the trustees of the trust, non-partisan, not partisan facts from a certain party, but from the trustees. More and more physicians are leaving as are not taking Medicare patients. That's problem number 1. Problem number 2, according to the trustees, problem number 2 is that if nothing is done, it goes bankrupt. Just you take those 2 problems alone, and I say to people, well, do you want us to ignore the problem or do you want us to try to solve it? Most people say, let's try to solve it. Say, okay, now let's have a dialogue about the best way to solve it. And I think that we need to have a productive, positive conversation nationally, because this affects not just people who are 55 and older, but people who are 55 and older think about their children and their grandchildren. And how is this system going to work in the future? And I think members of Congress, and myself certainly, are committed to preserving it, to protecting it, but to make sure that we've got a foundationally strong program that works for everybody, works in the long term.
Does testing figure into your calculus?
I think there's a lot of different ways that we can do it, and I think considering someone's income is on the table and partly could be part of a solution. It's not the single, silver bullet, but I think it's one of many options that ought to be considered and will be considered as this debate continues. I think the debate will continue for another couple of years before there's any real reform. I know that the President and leadership in the House and the Senate tried to come to an agreement on some reforms earlier this year. They fell short, but even the President of the United States is saying that Medicare has to be changed. And when the President of the United States is saying that, as a member of the House of Representatives, I want to work with him and anybody else who's willing to do this in a responsible way. So, I'm committed to that, whether it's Republicans or Democrats in the House or the Senate or the President of the United States. That's going to be my focus.
Do you support a voucher system?
I don't think a voucher system makes sense, and I don't think that's what's been proposed. But there's differences of opinion. But I would disagree. I don't see it as a voucher system. I know that that's what the Democratic Congressional Campaign Committee says, but in my view, it's not a voucher system. And there are members on the committee, both Republican and Democrat, who would disagree that it's a voucher system. So, but that being said, I know we've got to move on to our next meeting, next event.
Website. Nancy was a Republican.